Hi, welcome to Module 3 in Phlebotomy. This is Lecture 9, and today we are going to talk about the pre-analytical process in phlebotomy. If you're not clear on what the pre-analytical process is, we'll talk about that a little more in depth. And you will learn to identify 3 areas of that pre-analytical phase that you are responsible for. You will also learn to identify common errors which may occur before the collection of a blood sample. And you will learn to identify common errors which may occur during the collection of a blood sample. The 4th thing you will learn is to identify common errors that may occur after the collection of a blood sample. You will learn to define hematoma, hemoconcentration, hemolysis, and fasting. And you will define pre-examination variables that are related to blood collection and how these can impact the quality of the lab tests and the patient outcomes. In your PDF, the module outline at the very first level or activity in this module, there's also some videos under Module 3. One is regarding labeling at the bedside, and one is regarding a final check for quality for patient safety. So please open those up and review them. So just a review of the testing process from before. Pre-analytical is everything that happens before the testing process occurs and is the area that the phlebotomist is responsible for. Analytical is anything that happens during the testing process or on the instrumentation, and post-analytical is everything that happens after the testing process. And you can review this slide from previous lectures. You will be expected to know all the key points on this slide. So when we talk about pre-analytical phase, there's tons of things that can go wrong prior to analyzing the sample. So we break those into 3 categories themselves: before collection, during collection, and after collection. So before collection, you can see in red the most common errors that happen that affect testing. So before collection, the most serious mistake that can occur and the most frequent thing that happens is a patient's misidentified. The wrong labels on the wrong tubes, or the wrong patients drawn, or something happens with the identification of that patient. The wrong tube may be used. This is a very common error. A tech may grab the wrong tube out of order, or they may not understand what tube is to be used for what test. It is your responsibility to learn what tube is used for what test in what department. The other thing that before collection that is really a huge issue is improper site prep. If you're collecting blood cultures and you don't sterilize the site, you're not going to have good collections. You could contaminate it with bacteria that may affect the test results. Or if you leave the tourniquet on too wrong, that could be a problem. So during collection then, the extended tourniquet time can really affect laboratory results. And the wrong order of the draw. So if you draw things out of order, there's a specific order for tubes, which we will talk about. The other thing during collection is failure to invert the tubes to mix. So if you don't mix the tubes right away, they can be clotted when they aren't supposed to be. Underfilling tubes have to be filled, especially coagulation tubes, for the right ratio of anticoagulant to blood. If you underfill tubes, especially if they have anticoagulants in them, you can actually give false results because the results will be diluted out, the blood will be diluted by the anticoagulant and cause bad results. After collection, some pre-analytical things that can go wrong is maybe the serum isn't separated right away from the cells, there's delays in processing, certain tubes are exposed to light, they're not stored correctly. So each laboratory has a policy and procedure manual which you should review. This contains written procedures for collection. So when we talk about identification, how to prepare the patients, and there may be a specific checklist of questions to follow. So remember, the ID bands can be wrong. So if the patient states something that isn't the same as the ID band or not the same as your requisition, you need to go get someone else to help. If they're unable to verify their ID, you need to go get someone else, a relative or a healthcare provider, and then document that name. Make sure you understand what information is required on the specimens and on the test requisition for your facility. In general, they have to state and spell their names, plus a second identifier, which is frequently the date of birth or a medical record number. So other things that can be pre-collection variables, it may be some factor associated with the patient's activity. So for instance, we need to ask them, when is the last time they ate? Don't just ask, are you fasting? Some patients may not understand what fasting means. You need to ask, when was the last time you ate? And did you have anything to eat or drink in between there? So they may tell you the time of their last meal, but they may not tell you that they had a diet pop this morning with their vitamins. So you need to specifically communicate clearly, practice your core abilities, and get that information. In older patients, they may need to lay down, or they are frequently laying down. For certain tests, we need a patient to have their basal state. So patients ideally should be drawn not right after strenuous exercise with at least 12 hours fasting. That's the ideal time to collect blood from the patient. Their body's at their resting state. Normal or reference ranges are determined from patients at this state. So anything that the patient has done to alter that state, if they've exercised, if they just ran the steps, in some older patients, even just walking from the car is not going to get them back to their basal state by the time you draw their blood. They may need to sit 15 minutes. Some other factors we cannot control is smoking. There are certain tests we may need to note if the patient is a smoker. We can't correct for altitude. We cannot correct age and gender, but these are all pre-collection variables. So remember that our test results are dependent on age and gender ranges, so we have to make sure we note that. We cannot control pregnancy, but we need to note it in the diagnosis. We cannot control their medications. However, if they're on a therapeutic medication and that's what we're testing for, we may need to ask when the last time of dose was. On some inpatients, the timing of the collection is very specific. You may be asked to draw 2 hours after the IV infusion is done. You may be asked to draw right before the IV infusion starts. And you should always note this on the requisition. There's a concept called diurnal variation. So in a human body, concentration of various things in the blood change depending on the time of day. So for instance, cortisol levels, they change depending on the time of day. So we need to make sure we know the collection requirements for those types of tests and collect them at the appropriate time. Other pre-examination factors are diet. If a test is ordered as fasting, the patient should not eat or drink for 10 to 12 hours, and it's usually 12 hours prior to the test being drawn. They are allowed small sips of water. Again, it's your responsibility to determine if the patient has been fasting, and you need to note on there 12-hour fast, 14-hour fast, 16-hour fast. And if the patient has not been fasting, you need to make sure you write on there non-fasting, 1 hour postprandial or after they've eaten, 2 hours postprandial. Okay, a fast is at least 10 to 12 hours. Anything less than that is postprandial or after they ate. So posture, patients' posture can have a lot to do with their pre-collection factors. If they have liver disease and heart disease, values might change depending on if they're sitting up or lying down, and this is more of a concern in older patients. The other thing about posture is that most patients should be sitting up. Unless they're inpatients, they lay down, but most of the time we do what's most comfortable for them. Usually by the time you sit a patient down after standing, their blood will stabilize while you're getting your stuff together. For certain tests like cholesterol, they may have to sit 15 minutes before we draw their blood. And always remember to instruct the patient, because if you leave a patient sit for 15 minutes and not tell them why, they are going to think that you've forgotten them. The other thing about posture is be cognizant of people standing up and sitting down or laying down if they have a tendency to faint. So we want to keep them sitting down or drawing them in a laying down position. So pre-collection variables also stress. If you have a person who's really calm, or I'm sorry, if you have a person who's really frightened or has a needle phobia, hormones such as aldosterone, TSH, growth hormone. Sometimes the white blood cells may be falsely increased, and iron and carbon dioxide levels will be falsely decreased. So you do want to have a calm, confident manner, speak in a low voice to patients, but make sure they can hear you, and do a little, while you're drawing, do a little chit chat to kind of calm them down or rest them out, or listen to the patient, ask them questions they can answer. So that also helps calm them down. Medications, again, documentation of the last dose. Here's a chart that talks about a medication and the tests or systems that it can affect. It's important to remember that acetaminophen is metabolized, which is also called Tylenol, metabolized through the liver. So overdoses of Tylenol will cause increased liver enzymes. Cholesterol-lowering drugs are also metabolized through the liver. They may actually cause increased PTT, which are coagulation times. Some antibiotics can affect BU and creatinine and electrolytes. Diuretics may affect calcium, glucose. Chemotherapy can affect red cells, white cells, and aspirin can affect some tests associated with bleeding. Radiographic contrast media. So sometimes in x-ray they give them contrast media to check their kidney function, because they can actually do an x-ray procedure on that. That will affect routine urinalysis. So you want to get that urinalysis sample ahead of time before they go into the radiographic contrast media for x-ray. The same thing with dye will affect certain things. Oral contraceptives may affect some results. So it's important to note when you're asked if they're on medication. Okay, here again is a critical step of patient identification. The standard is very specific on the process of identifying patients, and if you're not clear on that, please go back to lecture 6. Again, patients not identified correctly present pre-analytical errors, and there's no other quality control check that will pick that up. Once the sample is labeled, barcoded, and submitted to the lab, it runs a test, the lab does, and releases the results according to that patient. So if it is the wrong patient, it is rare to pick it up at that point. So the place to pick that up is pre-analytically when the phlebotomist is identifying the patient. So please make sure you know your facility's policies and procedures as to which 2 specific identifiers for patient ID that are used. Not all facilities use date of birth as their second identifier. Some of them may assign patients a specific medical record or other number. Okay, so during the collection process, we're still talking about pre-analytical errors, but we're talking about the part that happens during collection. So if the tourniquet's left on too long, you can affect the lab results. So once you're ready to get into the vein, the tourniquet should not have been on there longer than 1 minute. If more than a minute has passed, you release the tourniquet and reapply after 2 minutes. So when you're examining for the vein, you apply the tourniquet, find your vein, release the tourniquet, get your stuff ready, sterilize the site, reapply the tourniquet, and then draw within a minute. What happens is when the tourniquet's left on too long, the blood becomes hemoconcentrated. So it becomes more full of cells, less full of plasma, because the blood flow can't go past that tourniquet. So then that affects all the analytes that you see here. It can affect the blood cell counts, it can affect potassium, it can affect hemoglobin, hematocrit, glucose. It can kind of skew the results so they're not accurate for the doctor. There's other analytes that are also listed, and we need to really pay attention to how long that tourniquet is applied, and we will practice this in class. So other errors during the collection process, one error is hemolysis, where the red cells are ruptured. And it is a very common error, unfortunately. And you can see the reasons here why a patient's blood may be hemolyzed. And what happens during hemolysis then is when the red cells are ruptured, whatever's in the red cells leaks out into the plasma, and it can affect test results either by interfering with the test or by making the plasma so red or serum so red from the hemoglobin that the light the change in results can't be read. Another thing that it can do is increase the potassium, because there's potassium within the red cells. So when that gets in the serum, we get falsely high potassium results. So you can see it's important to use a correct size needle, and make sure that you don't have too much pressure on the syringe when you pull back. You never want to draw through a site with a hematoma or force blood from a syringe into a tube. The tube will fill by itself if it's a good tube. You do not want to collect samples from IV lines, and you don't want to apply the tourniquet too close to the puncture site or for too long, because that can cause the red cells to hemolyze. You have to be careful when using fragile hand veins. And if you perform the venipuncture before the alcohol is dry, alcohol will lyse the red cells. Tubes have to be full. And if you have to readjust a needle in the vein, or if you do excessive probing, you may have a tendency to hemolyze the blood. If you have the bevel of the needle against the side of the vein, blood may also hemolyze. So this table tells you about which analytes are seriously, noticeably, and slightly affected by hemolysis. So make sure you're familiar with that list. So other errors during the collection process, again, bad technique. If that bevel of the needle is against the vein, wrong order of the draw, short or underfilling tubes, failure to mix the tubes properly. They need to be inverted. You never want to shake them. If you don't shake them or don't invert them to mix and they clot, they may also hemolyze. So errors after the collection. So we're still in pre-analytical errors, but we're in the third phase, errors after the blood is collected. Again, if we don't separate the serum from the cells, if we don't use the tubes correctly, if there's delays in processing or samples are exposed to light and other improper storage conditions, if we rim the clots, if we take sticks or a pipette and kind of go around the clot before we spin it down, that can break the red cells. And then tubes need to be clotted completely prior to centrifugation. So if it's a red top tube, it should clot at least 30 to 60 minutes to make sure the clot is completely formed. So you can see sometimes why it's better to use plasma and we don't have to wait for the serum to clot. So in conclusion, the biggest thing is be really familiar with the policy and procedure manual for test prep requirements. We can control some pre-analytical factors, not all, but we do need to make a note if the patient is a smoker for certain tests, and document that the patient was not fasting if they were supposed to be. Patient identification is critical. Make sure you follow the protocol and use proper collection technique and sample handling with rapid transportation to the lab. If you question a policy or a procedure, or you're not familiar with a test, make sure you contact the laboratory and ask for clarification. Make sure you can find that information if you need it in the laboratory information system, and make sure you do it prior to starting the blood collection. Ideally, review the order. If you have questions, check on it, and then go get the patient. Thank you for listening to Lecture 9 in Module 3. And we will go on to Lecture 10.